Elevation Health, family and friends. Good morning. This is Dr. Dave Yachter. I have a question for you. Who are you bringing to our Heart Smart Nutrition Blockbuster Workshop event? September is Heart Health Month, and today we're going to be discussing the three biggest factors that will increase your risk of or worsen cardiovascular disease. We're talking about high blood pressure, coronary artery disease, stroke. And so we are going to address what to do to avoid these mistakes and the things that many of you are likely doing because of the information you've received from family, friends, and even your medical doctors. Unfortunately, many of these things are causative factors for actually promoting the disease instead of preventing it and causing early death. So this is super important because every 37 seconds, a life is lost to cardiovascular disease, something that's 80% of all of this is preventable. So for most of you watching this, it's 1 out of every 2 people you know right now, and this includes you and includes me, if we're not doing the things preventatively and have a game plan in place. So here are the 3 biggest factors that accelerate heart disease. Number 1, taking cholesterol medications. Why? Because in the American Journal of Cardiology, it was published that statin medications actually increase your risk of death. What? Yes. Researchers followed nearly 300 adults that were diagnosed with heart failure for an average of 3 years, and in some cases up to 11 years. And they found that those who were taking the statin drugs, the cholesterol drugs, who had the lowest cholesterol as a result of the medications, they were found to have the highest rates of mortality. In other words, more of them died in that part of the study. Conversely, on the other hand, people with higher levels of cholesterol had a lower risk of death. Why? Well, for a couple of reasons. Number 1, depleting your body of CoQ10 is never a good idea. Unfortunately, because this necessary molecule in every cell of your body, which is essential for vitality and energy, especially in the heart muscle, is stripped out of the heart muscle when you take a statin medication, a cholesterol-lowering medication. It's an essential nutrient that facilitates energy production, which is destroyed by cholesterol drugs. So this is not good for your heart. Obviously, this is why many people know you're supposed to take CoQ10, especially if you're taking statin medications. The second reason is statin drugs, cholesterol medications, inhibit the production of vitamin K2. Now, many of you know this is important because we give it to you with the vitamin D. It helps your body absorb vitamin D, and you know that low levels of vitamin D are associated with heart disease. Well, the reason why is because vitamin K2 actually protects the arteries from calcification, and coronary calcification is a huge risk for coronary artery disease. And statin medications actually strip the K2. It actually blocks the K2 production. I'm sure many of you would agree this is something that we want to avoid if possible, but this is why I'm bringing this up. A lot of people are not aware of this. Did you know that those who are on cholesterol medications have weaker immune systems? Studies show that cholesterol medications, statin drugs actually increase your risk of cancer. They found a high correlation with women who were taking statin medications for 10 years or more, had a significantly increased risk of breast cancer. And also, similarly, they found a study with diabetics. Those who were taking statin drugs for 2 years or longer had twice the risk of type 2 diabetes. So you can see that all of this is pointing to metabolic dysfunction and all types of other side effects, which, if there's a way to avoid this, why wouldn't we want to do this? And this is why I'm bringing this to your attention. So that's point number 1. Point number 2 is too much sugar. This will increase your risk of heart disease. Why? Because we know now that coronary artery disease has more to do with metabolic disease. It's a disease of inflammation. And what causes inflammation? Sugar. And when the sugar molecules attach themselves to LDL, which is the so-called bad cholesterol, even though there's really no such thing as bad cholesterol and good cholesterol, they're all lipoproteins, so to speak, which actually It's a transport mechanism. It's a shuttle that brings cholesterol to the cells everywhere in your body to be repaired and regenerated. And in your brain, the neurons depend on this cholesterol to actually function properly. And that's why they see that one of the major side effects of cholesterol medications is how it affects the memory and affects brain function. So sugar molecules, when they attach themselves to LDL in the bloodstream, that has a propensity to cause inflammation of the lining of the blood vessels. And that's what increases the risk of heart disease, not the cholesterol. It's the sugar which provokes an inflammatory response. And so if we can look at the cause and we can correct the cause, then the effects take care of themselves, right? Point number 3, that accelerates heart disease, low-fat diets. And we've long been told, historically, for decades, to reduce saturated fats, have a diet low in fat, high in complex carbohydrates. You know, that food pyramid from elementary school that we were taught. Well, we talk about this at the workshops, that we need to turn that pyramid on its head, because those recommendations over the years have actually caused more cases of diabetes and heart disease than we ever had before. You cannot eliminate the fats from your diet. Good fats help your body burn fat. Good fats help your body repair the cells and regenerate new healthy cell membranes. So you can't throw the baby out with the bathwater, so to speak. Not only that, studies of heart disease patients they've done these studies, hundreds of thousands of people in these studies, and they were demonstrating how the reduction of saturated fat did not result in the reduction of death rates, heart attack, or stroke. In fact, it was just the opposite. The people who had the most saturated fat in their diets had the least risk of heart attack or stroke and the lowest death rates. And so these are statistics and these are studies that I usually provide in the workshops. So you'll learn all about this in the workshop. If this is foreign to you, or it's stunning or hard to believe, you need to be at this workshop coming up on Tuesday. So this is what you're going to learn about. You'll discover all of these hidden, insidious thieves of health that lie in your pantry, in your medicine chest, and most importantly, in our head. It's what we think that causes us to make the decisions that we make. And if we don't have the right information, we don't make the right decisions. If we don't make the right decisions, we don't get the best results. And as far as I know, if you're a patient in my office, I think you've probably mentioned at some point in agreement that you're trying to stay out of doctors' offices, off medications, out of hospitals, avoid needless crisis visits to the doctor in the emergency room, avoid drugs, avoid surgery. Well, this is where the rubber meets the road. If you really want to learn how to do this, make sure you get registered for this workshop. There's only a few seats left. It's coming up Tuesday, September 12th. You'll get all the answers to all this, as well as how to reduce your risk of heart disease by 80%, get better control of your blood pressure, your cholesterol, learn how to reverse type 2 diabetes, and just learn about the most powerful heart healthy nutritional strategies that are known today. So you'll get all this at our Heart Smart Nutrition Workshops coming up Tuesday, September 12th. Please make sure you're registered. If you haven't done so, go ahead up to the front desk, get your name down there, put the names of your friends, family members, loved ones, whoever you know that needs help. You may have friends or family members that are on medications for high blood pressure, for cholesterol. Maybe they're overweight. Maybe they have diabetes. You know, people are looking for answers. They're looking for solutions. They're looking for ways to end their misery and their suffering. So please, when I tell you that the workshop is the beginning of a journey to a better future, you have an opportunity to be a blessing to somebody. Think of who it is that needs help. That's why we're here. So make sure that you do that. Get yourself registered at the front desk. Use the phone number. If you're watching this online, call the office and reserve your seats that way as well. So thank you so much for joining me today. I look forward to seeing you there. God bless.